Hi everybody, it's David Porter, and this is part 2 about benzodiazepines. In a previous video, I described the most common benzodiazepines: Valium, Ativan, Klonopin, Xanax, and also Rohypnol and Versed. And I discussed the legit medical uses that they have, as well as some precautionary words about Rohypnol. So I want to look more closely, examine more closely the abuse potential because of the benzodiazepines. Because the benzos, again, they have legitimate medical uses, primarily as for pre-op sedation, for outpatient awake sedation, as anxiolytics or anxiety relieving meds, hypnotics or sleep inducing meds, and muscle relaxants, and also anticonvulsants. So they have many legitimate medical uses, but they are highly addictive. They will produce physiological dependence in a very short time, even when taken as prescribed. Physiological dependence means that you may not enjoy taking them, you may not crave them, you may not have feelings of euphoria that you are seeking to relive, but you will become physiologically dependent. And here's why. Benzodiazepines are also in the class of drugs and meds known as central nervous system depressants. A central nervous system depressant is going to slow down the action of the central nervous system. It is going to basically put you in a parasympathetic response. Parasympathetic division of the autonomic nervous system regulates the rest and digest response. It's going to slow everything down. Now, the parasympathetic and sympathetic divisions are always trying to maintain and restore equilibrium or homeostasis. When you have been in a prolonged state of induced parasympathetic activation, everything is slowed down, and you take away the benzos, which have been producing this state, your nervous system is going to rebound violently, suddenly, and you're going to go into a sympathetic response, which is fight, flight, freeze. You're going to feel agitated, restless, anxious. You're going to have going to feel irritable, and you're going to have insomnia. Now, depending on how long you've been taking the benzos and what doses, and a variety of other factors, including the route of administration. Are you taking them orally as prescribed, or crushing and snorting them, or crushing and mixing them with a liquid medium and taking them intravenously? This will increase the bioavailability, in other words, the amount of the drug your body can actually use, and shorten the onset of action, and may also shorten the duration of action. A rule of thumb is when a drug has a rapid onset but a short duration, it increases the addictive potential, psychologically at least, maybe physiologically as well. Now, in extreme cases, you're going to get tremors, you can have a grand mal seizure, your blood pressure can become dangerously elevated, you could have an MI, myocardial infarction, or heart attack, you could have a CVA, cerebral vascular accident, or a stroke. So benzos are potentially dangerous. They are highly addictive. They also can produce psychological dependence. If you are genetically predisposed towards chemical dependency and have other basically vulnerabilities towards addiction, you may very much enjoy the euphoria and the feeling of relaxation and the anxiolysis, or freedom from worry and anxiety, that these meds will produce. And that feeling can become too enjoyable where you're going to crave it, you're going to want to repeat it. Benzodiazepines do not act directly on the dopaminergic system, So you're not going to get a direct dopamine chain of, boy, that was good, don't forget, go get more. You will get a powerful secondary reward, which is that relaxed, pleasant, carefree sensation that can persist for up to 12 hours depending on what type of benzo you're taking and the way you take it. So this makes them psychologically addictive as well as physiologically addictive. So benzos, in my opinion, should never be prescribed to somebody with a history of chemical dependence. At least not for outpatient use. If necessary, inpatient use only, and very limited. Even for people who do not have a history of chemical dependence, they must be prescribed with great caution. The wind is blowing, and I hope it does not tip over my camera. You probably saw the camera shake. Even for people without a history of chemical dependence, they have to be prescribed with great caution. My opinion is they should not even be used outpatient. We don't need them anymore for things like for its hypnotic effects to relieve insomnia. We don't need them for anxiety. SSRIs, selective serotonin reuptake inhibitors, work very well for relief of anxiety. They just don't work quickly. The non-benzo hypnotics, Ambien, Lunesta, what's the other one? Ambien, Lunesta, and I'm drawing a blank on the third one. How ironic. I'm talking about a med that can induce memory loss. Sonata, there you go. Ambien, Lunesta, and Sonata, which are atypical hypnotics. Yeah, they have the potential for some pretty weird side effects. More about that in another video. But they're much safer than benzos. Yes, they have a slight abuse potential, but much lower than benzos. And here's the other thing: if you have insomnia, you should not be taking a med to knock you out night after night after night. Insomnia is very often a symptom of another condition. Legitimate medical uses of benzos and reasonable precautions. I really question whether or not we need them because there's so many alternatives today. If they're going to be used, use them inpatient. Intravenous administration for management of seizures. Pre-op sedation to relieve preoperative apprehension and to depress the central nervous system and make it easier for the general anesthesia to work. I really question whether or not they're needed, or if they're going to be used, here's how you use them. You get a script for 2, and you take them for an acute anxiety-inducing anticipated event, i.e. you need to fly and you hate flying. You take a benzo before you get on the plane, a half hour before you get on the plane. You probably won't even remember the flight. You may not even remember the flight. You're going to be relaxed. You may fall asleep, or you may, depending on what type of benzo and your predisposing factors, you may not even remember being on the plane. It wears off, you step off the plane. When you need to get back on the plane to go home, you take another one. Or you get a script for maybe 10 of them, and those should last you a year. You only take them when other measures to manage anxiety have failed. And that means you're probably seeing a therapist and doing good cognitive behavioral therapy techniques to manage anxiety. You may be taking a non-benzo anxiolytic, such as the aforementioned SSRIs, and you are taking very good care of yourself to manage your chronic anxiety to prevent those spikes of acute anxiety. There are so many alternatives to popping a benzo. You reserve them for the very worst situations where you cannot bring yourself down. And a script for 10 should last you a year or even a little longer. Okay, so those are some precautionary thoughts on benzos and their abuse potential. And by the way, when meds are legitimate medications are used for abuse, that's referred to as diversion. Also, a couple other things for beginning students. You'll probably never hear the word medication. You will only hear the word meds from professionals and even what you call experienced patients, people who have chronic or multiple medical problems where they have regular contact with physicians. You will also probably never hear the word prescription. You will hear the word script. Again, professionals rarely, if ever, actually say the whole word prescription, nor do experienced patients. Okay, so thank you for watching, and please hit subscribe. How do you shut this thing off?